Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm Anthony Morneau. In El Paso and in the surrounding borderland region, a new initiative is underway to help reduce new HIV infections called Vamos Bien con PrEP. The campaign highlights the TelePrep program, which is available remotely to individuals with no in-person doctor appointments. Pre-exposure prophylaxis, or PrEP, is a once-a-day pill that has shown to reduce the chance of individuals contracting HIV. Joining us to talk about the program and how it can be used to prevent HIV infections in the borderland region is Dr. Leandro Mena, who is an STD HIV clinician and public health advocate. Dr. Mena is based in Jackson, Mississippi, where he is the medical director at Crossroads Clinic and Open Arms Healthcare Center. He is also an associate professor of medicine within the Division of Infectious Diseases at the University of Mississippi Medical Center, and he serves as the director at the Center for HIV Research, Education, and Policy at a local institute for the elimination of health disparities. Dr. Mena, thank you so much for joining us. And I want to start off, we've seen an increase in the HIV Latino population. So how do you feel this program can address that issue within the Latino population?
Hi, and thank you so much for the opportunity and the invitation to be here and share with talk to your audience and with you. I think that it is true. In the past several years, what we have seen in the United States, it has been a progressive. While the overall number of new HIV infections have been decreasing. For totally. And for many key populations. We have seen the rates of HIV infection increasing among the Latino population. And increasing among the Latino population, among youth, increasing among men who assist with men who identify as Latino or Latina, transgender women. So what's important is that science has given us the tools, to really end the HIV epidemic. In one side, we have treatment of HIV, that not only can prevent people developing AIDS, it can also by treating those individuals who are living with HIV, can really, stop the transmission of HIV from someone who is infected to someone who's uninfected. In the other side, PrEP is this, amazing tool, that we have for the first time in almost 4 decades of the HIV epidemic, that by taking it every day, individuals who, may have an indication, for PrEP, individuals who may be an increased risk of becoming HIV infected can then suddenly significantly reduce that risk of HIV. The challenge that we have, sorry, go ahead.
Now, I mentioned that at the beginning, what PrEP was, the once-a-day pill, but can you give us some more information on what exactly PrEP is and how it works to stop the potential infection of HIV?
Right, so PrEP is a strategy. Right? The strategy, consists, right now in the United States, there are 2 drugs that have been approved by the federal, for the FDA, Federal Drug Administration, to be used for pre-exposure prophylaxis. Prophylaxis is something that you do before, an event happens so you can protect yourself. So the analogy that sometimes I like to use is that if you compare with birth control, birth control, it's in different ways, but imagine the pill that women take once a day, that if they take it every day, it can significantly reduce the risk of becoming pregnant. PrEP is a pill, it's an HIV medication that can be used also. And we have a lot of experience, in its safety and its effectiveness to treat HIV. But for individuals who are not infected with HIV, for people who test HIV negative, they can receive a prescription and take this pill every day. If they do that, that can significantly reduce the risk of becoming HIV infected. Because it's a prescription, you have to see, be seen by a clinician, a doctor, a nurse practitioner, a physician assistant, someone who has a license to prescribe medication. And this medication, this prescription is given for about 90 days. Uh, every 90 days, you come back to the doctor, you get tested for HIV, making sure that you continue to be HIV negative, and you take it for as long as you need it. Different to HIV treatment, which people have to take for the rest of their life. PrEP is something that people take, for seasons of risk. There are times where you may not necessarily, need to take PrEP because you may be in a monogamous, relationship with someone who is, HIV negative. There are times where you basically, testing the grounds, and it makes more sense, for you, since trusting someone and really getting to know someone takes time, making sure that you are protected by taking PrEP.
So who should consider taking PrEP or giving it a try?
PrEP is for everyone. The CDC recommends PrEP for individuals who are at substantial risk of becoming HIV infected. When we talk about, there are certain key populations that we know that have a higher chance of meeting, sexual partners that potentially, could be living with HIV. Those are men who are having sex with men, but heterosexual individuals, who may be having, sex with other people who they do not know the HIV status. If they're having sex without condoms, people who have recently tested positive for any STDs, individuals who have, when have sex, under the influence of either alcohol or drugs, which may affect the judgment on what people do. And there's evidence that individuals who have been recently incarcerated, or people who may have sexual partners who have been incarcerated, are all in a group, that can really benefit, from taking PrEP to reduce the chances that they will become HIV infected.
Now, you mentioned people incarcerated. Do they have access to PrEP?
Individuals while incarceration, in general, they don't, right? Most jails, will not really admit that people have sex, while incarcerated. There are few very novel programs in our country that actually are providing PrEP, for individuals while incarcerated. But this is something that, when health centers, that are caring for people who have recently been incarcerated, I mean, depending on populations, and we know about our correctional system that disproportionately, affects racial ethnic minorities. People who have recent history of incarceration are people who should consider, starting pre-exposure prophylaxis.
Now, HIV infections in New Mexico in 2018, according to the Department of Health, there were 125 new cases of HIV, a 9%, over 9% decrease from the year before. 80% of those new infections that the Department of Health listed were males, and 54% of those infected with HIV were Hispanics. So even though there was a drop, is there any specific population that you think this new program could help, TelePrep could help here in New Mexico? Because we do have a lot of rural areas in the state.
So absolutely. I think, as I say, when you look at total numbers, sometimes can be misleading. Sometimes you have to break it down, okay, there was a total, decrease, because sometimes certain populations experience, a bigger decrease. I mean, I know nationwide that the total number decreased because there was a decrease in the number of HIV infections among women. There was a decrease in the number of HIV infections among men who are men, who are white race. I mean, there was no change about Black men who are men, and there is an increase in Latinos. So once you break it down, by race, by age, what you may find is that among Latinos, especially young Latinos who are sex with men, the rates didn't increase, they decreased. The rates actually increased. So again, we're living in a world, where the risk, every new infection of HIV, you can argue that it's a preventable infection. So every person who perceives, who thinks, that they can benefit, from taking this, pill to reduce the risk of HIV should be able to have access to this. We know that individuals, who live in rural areas, because PrEP, is something that we're doing, to reduce the consequences of having sex. And because, talking about sex sometimes is something that is very stigmatizing, in our communities. So if you add to that, talking about sex with men in our culture, in Latino culture, right, can be, very stigmatizing. There's a lot of homophobia. Um, Even when you may have access, to a clinic where the PrEP can be provided, people sometimes people is not always comfortable coming there, disclosing their behavior. In the same way, providers are not comfortable taking care of people. So we know that individuals who live in rural areas very often have challenges. I mean, there is transportation because the clinic that may provide PrEP may not be maybe 1 hour distance. They may not have transportation. If they have transportation, they may have to rely in a family member or a friend, to whom they may or may not want to disclose the reason why they're coming to the clinic. The other thing is that sometimes there are issues around confidentiality. People may not want to go to that only clinic where a family member or a family friend or someone that they know, works in the clinic, so they're concerned about the confidentiality. So what Vamos Bien con PrEP and the program, right, is trying to do is use telehealth as a safety net, so people can go into the website. The website is teleprep.org. Anyone can go in and get information about what PrEP is, and then if you're interested in more education or interested in making an appointment, you can make an appointment. So what we do is that we connect you via telehealth, which is almost like a FaceTime visit. And if people, is interested in getting on PrEP, what we do is that we send people home a little test kit, a box, where people can do all the testing that normally would have been done in a clinic. We test them for HIV, we test them for gonorrhea, chlamydia, syphilis, some of the common STDs. We also test them, to make sure that the kidneys are working normally. And after all this testing is done, via telehealth, we start people on medication without having to step, into a clinic, into an actual clinic. So that, provides a tremendous, make things, a lot easier for people who may feel, uncomfortable walking into a clinic, or people who because of structural reasons, lack of transportation, maybe, they don't have health insurance, to cover the cost of PrEP in the one clinic, that is close to them, may not be able to use those choices.
Yeah, we have a pandemic going on right now as well, so there is a added incentive, obviously, for a lot of folks. I want to talk about affordability. How affordable is this program to folks who may be at risk of catching HIV? How can they get some help?
Right, that's a fantastic question. We know that cost, is one of the most important concerns that people have when it comes to using, pre-exposure prophylaxis. I mean, the drugs that we use, for PrEP are expensive. There's a HIV medication that costs, over $1,000. But luckily, there are programs that will cover, the total cost of the medication for both individuals who have insurance, so they don't have to have any kind of out-of-pocket cost, and for people who are insured. The manufacturers of these medications have a patient assistance program that will give the medication for free to anyone who does not have any kind of who does not have insurance coverage. And PrEP is something that is endorsed by the United States Preventive Task Force, which means that all Affordable Care Act certified health plans, should cover PrEP without any kind of requiring any copayment. So in other words, there is some cost, but the program and the teleprep.org makes sure that regardless, of your ability to pay, you'll get PrEP.
Now, you mentioned that within the Latino community, there may be a stigma with talking about this issue, but what about healthcare providers? Are they mentioning PrEP as an option in the U.S.?
So it's a little bit of a paradox. I mean, and we know that over time, PrEP is something that, we're still talking about it, right? the first, drug approved for pre-exposure prophylaxis was approved by the FDA in 2012. So it's been 8 years. And what we have seen in the past 8 years has been a significant increase, in the number of providers who are, providing pre-exposure prophylaxis. Yet this number continues to be, significantly, small. We know there is data from 2018 that the CDC estimated that in the United States, about 1.2 million people, could benefit from PrEP, out of which 25%, of that 1.2 million people were individuals, Latinos, right? So at that time, only 4% of Latinos who have PrEP indication were actually taking pre-exposure prophylaxis. There have been some recent surveys that have shown that in some geographic areas, especially in large metropolitan areas, the proportion of Latinos who have indication for PrEP, have increased, but still, it's probably only 10%, 15% of what it should be. If you move now into the rural areas and less popular areas in the South, that, gap is even bigger.
According to the 2019 HIV surveillance report in the state of Texas from their Department of Health and Human Services, in 2018, there were 137 people diagnosed with HIV in El Paso County. That's up from 120 the previous year. Could you give us some analysis on how at risk the borderland region where we are at right now is dealing with the HIV infection rate?
So yeah, absolutely. I mean, looking at diagnosis rates is a little bit tricky, right? Because when you diagnose someone with HIV, it just means you tell someone you have HIV, right? But when people get infected, we know that it takes 8 to 10 years from the moment that people is infected with HIV to the moment that people develop AIDS, right? So people may have had HIV for many years before they're diagnosed. In general, we know that, proportion of people, especially younger people younger than 30 years old, typically get diagnosed a little bit earlier. People who get diagnosed in their 40s or 50s probably have had HIV for quite some time. What's important, sometimes increased diagnosis rates is a reflection of increased efforts, right? To test more people and test people more frequently. What is no doubt is that we know that the rates of HIV are increasing, particularly in the border area. There are factors that contribute to the increase of HIV infection. We know that among young people, the HIV testing rates, among Latinos in general, the HIV testing rates are relatively low. CDC recommends that everyone should be tested for HIV at least once in their lifetime. And CDC recommends that people who are at risk of HIV infection, people who can, who have certain behaviors, and I don't like using the word risk, because people tend to exclude themselves. No one is at risk. I mean, people tend to underestimate the actual risk. But if you are having sex, without a condom, with someone that you don't know the HIV status, you are at risk. And you only need one partner. I always, remind people that in the United States, most people who become infected with HIV, only have one main partner. I mean, only have one partner, because those are the people that you love. Those are the people that you care about. Those are the people that you trust, right? And the people with whom, because you trust them, you don't think about wearing condoms, right? So in the among Latinos, the problem is that there is very low rate of awareness of their own HIV status. I mean, people who are living with HIV, and it gets worse, in the younger population. We know that in the people who are younger than 24, half of people living with HIV have no clue that they're living with HIV, right? They have not been tested for HIV. So again, getting tested is the first step, to start controlling our HIV epidemic. We know also that lack of health insurance, I mean, Texas, just like Mississippi, my home state, has not expanded Medicaid. And we have a tremendous proportion of our population who don't have health insurance. So we know that lack of health insurance is an important factor that limits, people access, to health services, including HIV testing, right? So to complicate that, we know that poverty, we know that low education, we know that stigma. I mean, the aggressive homophobia that that is a very prevalent in our communities, right? Makes people more uncomfortable to getting tested. People don't get tested not because they are or not gay, right? They don't want people to, they're afraid that of what people may think if they see me getting tested, right? That's the stigma around HIV. That's the internalized, and the stigma around homophobia that exists in our community that we have to address. So in the border area, you have all these factors, yeah, and then you have to add the 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 um the issues around the both cultures, right? The biculturalism and the binational, and not necessarily biculturalism, but the binational issues that happen in the border, where you have the traffic of individuals from one side to the other. What I've experienced in my several visits, for example, to El Paso, is that in El Paso you have a community that is relatively, conservative, right? And very often, Juarez that is across the border becomes the risk space, of this community, where people go across the border, right, to spend the weekend, to have a good time, right, and to do things that sometimes they may not want to do in their own communities because they are afraid about what others will say.
Now that we obviously have a pandemic happening right now and people may not be traveling out and about, and obviously they can't cross the border unless it's for essential reasons at this time, thanks to the shutdown at the border. But do you think that this is going to slow down the infection rate for HIV and AIDS?
That's an interesting question. We have, we have been doing some surveys asking people, as a matter of fact, asking our patients with PrEP, right? What are they doing? And what we have seen is that many of our patients, are reporting that their opportunities to meet sex partners have decreased. I've had patients who have called me and tell me, "Hey, doc, I don't think I want to come. I think I want to stop, taking PrEP because there's really nothing going on right now." Nevertheless, as things are normalizing, in terms of people is coming back one way or the other, to their normal life, things will come back. So going back in the short answers, I think that initially, with the pandemic and with the response, to the COVID pandemic, there probably was some kind of decrease, in people's interaction that probably, will have created opportunities for HIV transmission. But I think that temporary decrease, having sex, and the sexuality of humans is part of who we are, right? And it will find its way, up to the surface.
Now, obviously, there's a lot of reporting on how people are living longer with HIV due to medication and what's available. Do you think that this could be potentially causing more people to have unprotected sex because they know people are living longer with HIV?
Yes, absolutely. I mean, I think, one thing that we're seeing, in the backdrop is that we have, for the past 5, 6, 7 years, we have had an increase in the rates of sexually transmitted infections, right? And sexually transmitted infections, especially among men who is with men, and some people have talked about, perhaps if this has been an effect of PrEP. But if you look at when rates of STDs start increasing in the US, was way before 2012. I think that has been an effect, of the reality that medications, for HIV are really allowing people to live, productive lives. I said at the beginning of our conversation, treatment is prevention. If you're taking, treatment for HIV and you're living with HIV and your viral load, the virus within you is suppressed because of the medications, you can't pass HIV to others. I mean, so because of that, we know that that while treatment of HIV and PrEP can significantly reduce the incidence of HIV, they do nothing for sexually transmitted infections. And I think as a consequence of that, that's one of the factors, at least, that is contributing to the increase in the rates of other sexually transmitted infections in the country.
Now we just have a less than 2 minutes left, but I'd like to hear from you on what folks can do if they are interested in finding out more resources on if they should consider teleprep or PrEP.
Absolutely. So there's a website. My suggestion again, New Mexico, any New Mexico Department of Health office. I mean, Las Cruces or anywhere in New Mexico. You can go there. They have a fantastic program. There is a teleprep.org. You can go on the web. You can get information. You can make an appointment. If by any chance, for example, you prefer to get your PrEP delivered to you via telehealth, not everyone is comfortable in the same way receiving, a testing box at home or doing it from home. But if you are and you have the facility, to have this telehealth visit, that's an opportunity. And that's an option for you. So it's teleprep.org.
Okay, Dr. Leandro Mena, I want to thank you so much for joining us and sharing so much information about teleprep. Thank you.
Thank you for having me. It's a pleasure.
And we want to thank you for joining us for Fronteras. I want to let you know that we always want to hear your thoughts and feedback. You can email us at feedback@nmsu.edu. We're always looking for potential story ideas as well. And remember, we're on social media. You can keep up with us by liking us on Facebook. You can follow us on Twitter. You can also follow us on Instagram, and you can subscribe to the KRWG News YouTube channel where you can watch past episodes of Fronteras: Changing America. I want to thank you for joining us, and we'll see you next time.